Amid the COVID pandemic, there's an ongoing epidemic, HIV-AIDS. As with every December 1st, today is recognized as World AIDS Day. Amanda Vinicky joins us now with a look at what progress has been made and the challenges ahead when it comes to HIV. Amanda.
Yes, Paris, it has been 40 years since the first cases of what's now known as HIV-AIDS were first reported. In that time, 700,000 people in the United States have died. Now, back in 1981, Dr. Kathy Kredikos was graduating from medical school, and a short time later, she was serving as an infectious disease fellow at the University of Illinois, Chicago, one of 10 sites nationally and the only one in the Midwest selected to study the antiviral drug AZT.
To this day, I remember my patients extremely well because it was my first encounter with people who had so many different, they really came from all walks of life, but they all had a lot of challenges in their life. And of course, they were dealing with a deadly disease, and which they all eventually succumbed to.
There was a woman in her 30s, a prominent banking executive who lived on Lakeshore Drive, who had gotten HIV from her long-term partner, really defying stereotypes of the time. A man who, she says, kept a positive attitude even as he went blind from an infection that eventually killed him.
After I left the University of Illinois, I came to Illinois Masonic Hospital, which had really the very first inpatient HIV/AIDS ward. And we had 35 beds that were dedicated just to HIV patients, and they were always full. So, we would be staying late into the evening every day with these very challenging patients and deaths every day.
Despite those deaths, Dr. Kredikos says she was inspired to work with these patients because she learned what a provider could do. But even then, she says the drugs did begin to work and the rate of death decreased. Now she's been working with some patients for 25, even 30 years, and she says they are doing fine. When a newly positive patient comes in now, she talks about the hopeful situation that they're in today.
That we can restore them to health, we can give them almost a normal life expectancy, that they can have full relationships, they can have sexual relationships that are safe, and they can have family, biological family.
That is largely thanks to drugs. Illinois now requires most insurers cover PrEP. That's a prevention drug given to those at high risk of contracting HIV. Also, a new state law repeals a previous statute that criminalized when somebody had unprotected sexual relations without disclosing their HIV status. Just today, Chicago previewed a new AIDS garden that is set to open this spring. And the Department of Housing and Urban Development announced funding for housing for low-income persons living with HIV or AIDS. Director of Housing at AIDS Foundation Chicago, Brandy Calvert, says here that'll mean 40 new housing opportunities for people in the Chicago area.
Without adequate housing, people are not able to focus on their health needs. Without a stable home, you don't have anywhere to store your medications. You don't have a place with which to, plan out the activities for your life.
She says often homelessness is precipitated by a medical situation or an emergency. She says the need for housing supports still very much outweighs the availability of funding for it. Now, going forward, the White House does have a goal of ending AIDS as a health threat by the year 2030. And what that essentially means is the goal is to have no new cases by that point. Dr. Kredikos says that it is possible, but she says that is going to require more testing, more access to care, and more prevention.
Destigmatize HIV testing, destigmatize having HIV, and just remember it is a medical problem like so many others, and we have effective treatment, and stigma is preventing a lot of people from getting what they need. So we need to really destigmatize it. Still, 40 years into this, we still have to do that.
She says if you're at your annual checkup, your doctor asks to test you for HIV, don't be offended. That, she says, is a key part of prevention and that destigmatization she was talking about. Paris, with that, back to you.
All right, Amanda, thanks very much.